Hi, in the last video we discussed about the symptoms and etiological factors that are contributing to the TMD problem. Today we will discuss how we properly evaluate the patient in the clinic and why it's very important that you see your dentist to be evaluated properly, because there are many factors that need to be addressed. Usually, if I have a TMD patient, I book them for 1 hour. Reason being is that I need to collect a lot of information to know exactly what's happening with the patient. So we ask about the chief complaint, how long is the problem been going, what other treatments you have been taking, if you are taking any medications, medical history, if you have any other joint problems, what are some of the habits you do, what's your stress level, how do you sleep, how many hours, how good is your sleep, what's the breathing pattern, and many other things that are very important and crucial for any patients with TMD problem. Mainly those with chronic problems. The acute ones are easier because it's only newly happening, so usually it's easier to get out of it. But the chronic ones, they need to be evaluated properly. And of course, during that appointment, we need to evaluate the muscles, the joint, the range of motion, the opening, if there is any deviation. And one quick tip for you if you are at home and need to evaluate yourself is to see if you are able to put 3 fingers, of course they have to be clean fingers, between your teeth. If you are able to put 3 fingers and you do not have any pain when you put them between your incisors, then you are in good position, because this amount of opening is usually enough to be able to do your day-to-day eating, speaking, and everything. So range of motion is extremely important as a factor that decides how we are going to go with the treatment, and we usually measure it regularly to see the progress of the treatment. And also we look at the neck movement. As we said, the neck is extremely related to the TMJ, so we have to evaluate the range of motion of the neck as well. And of course, we have to evaluate the teeth. We need to see the condition of the teeth, the amount of wear, if there are any fillings, crowns need to be done, the periodontal situation, and how much there is a pain-related reason that can be contributing to the TMD. And of course, we have to evaluate the tongue. And you will not believe how much the tongue is extremely related to the TMD. Many people with big tongues, with biting on the tongues, with tongue tie, the motion of the tongue, the position of the tongue, and the size of the tongue, they are very important to be evaluated to decide if they are contributing to your TMD problem. And in most of the patients, we do ask for a panoramic x-ray. Reason being is that we need to screen the situation of the condyles and the health of the condyles. We want to see if there is any bony changes in the condyles, because that will take us into a different route of treatment. And most of the patients, the good news is usually they don't have problems in the condyle, and it's usually muscular reason, as we said, and it's usually easier to treat. One thing important, as in this x-ray, is when you lose teeth and you don't replace them. Some people will extract, let's say, a first molar, and they don't replace it with an implant or a bridge, and this will lead to the adjacent teeth to start moving into the space and the upper teeth to start going down and leading to interference. And in many patients, we see that this was the spark of the problem for their TMJ pain, and I really invite you all to always replace any tooth that you extract, because really the detrimental effects of it on the long run is extremely crucial, and it becomes more difficult to handle the after effects later on in life, rather than just deal with it initially without any complications. And in some patients, we would ask for a 3D scan or an MRI to be able to further investigate if we see any changes in the condyle, or if there is a locking. We want to see where is the disc, so we will ask for further investigation. And with all this information that we collected, we decide accordingly which way we will go with the treatment with the patient based on this information that was crucial and important to know about the case before moving on. And as I said, this is more crucial with the chronic patients. With the acute ones that they just bit on something and they have pain, this is easily reversible. The chronic ones that have been there for years, are usually more tricky and will take a bit longer until we help them, and the help will be, and the progress of the situation will happen slowly, but definitely inshallah they will have better results. I will see you in the next video to discuss about what you can do at home to help your TMD situation, mainly if it is muscular origin. See you there.